Some of the other secondary endpoints included response rate and time to second progression. Response rate was fairly significant in the patients on the olaparib, and some of those responses were quite durable. A fair significant number of patients were progressive free at almost 24 months. So it's a game changer. It indicates a need to screen our pancreatic cancer patients for these BRCA mutations. It is not an improvement in survival yet, but progression-free survival is a very significant endpoint. The alternative is continued systemic chemotherapy, and I think the study also showed the quality of life was not hampered with the olaparib. There were a few more AEs in the olaparib arm. There was greater fatigue and more anemia, but very well tolerated in that arm.